Hello there. It's a pleasure to meet you. I'm Dr. Murmurs. How do you do? Welcome to my cranial nerve clinic, where we really aim to see if your cranial nerves are affecting your sleep cycles. So this is a cranial nerve examination specifically related to insomnia. Alright, so I imagine you've been referred to my clinic because you probably experience some form of insomnia or inability to fall asleep quickly or inability to stay sleeping. Is that correct? Alright, well, not to worry, we're going to get to the bottom of this. I'd love to take some details from you to begin with, okay? Can you just confirm to me your full name? And your date of birth? And your zip code and house number? Great. How long have you experienced some form of sleep problem? Okay. And what would you describe as your issues with falling asleep? Okay. How many times do you wake up during the night? And can you describe your lifestyle to me? Okay. Good. I'm just gonna check my... Okay. How many hours a week do you work? Alright. Now, do you provide permission for me to examine you today? The examination will be fairly non-invasive. There'll be quite a few tests to understand the reactivity times and just in the general reaction of your cranial nerves, both the motor and the sensory arms. Okay, there'll be nothing painful at all during this examination. In fact, you'll probably find it relatively relaxing. Now, I just need to understand if you've had any strange muscle weakness in the last while, any issues with speech, movement, okay, eyesight problems, hearing problems. Alright. Okay, so I'm just going to pop some gloves on. I can see that your speech is good. I've been monitoring you during this time to just really get a feel for how your motor neurons are working. Okay. Are you okay to sit up a little bit? Just so I can check your posture. That's fine. You can slouch again if you would like to. So our first cranial nerve we're looking at today is your olfactory nerve, responsible for your ability to smell. It's a great cranial nerve, one of my favorites. So, have you noticed any changes in your smell lately? Okay, and actually taste as well. Any changes in taste? All right, okay. So we actually have several lovely little bottles here of essential oils. They're the most common essential oils that the majority of people recognize the scent to. So we're going to test whether you can tell me what the scent is. Alright? So this is number 1. I like to test myself just to make sure that it's the right scent. We're just going to... Alright. Correct. This was cinnamon. Okay. The next one. It is indeed lavender. Correct. This is tea tree oil. Correct. It is indeed lemon. And the final one. Correct. It is indeed sweet orange. Alright. So, I don't identify any issues there at all with your olfactory nerves. They smell perfectly. So great job at keeping that cranial nerve nice and refined. Okay. Now we're going to move on to your optic nerve. Now your optic nerve requires quite a lot of examination. So we look at acuity, we look at the ability for you to focus, to follow the light, etc. There's quite a few. So you're happy to proceed? Great. Alright, now do you need to put on your glasses or... Alright. Now, I would like you to direct your gaze to the Snellen chart here and please start reading off the first line. And the second line. Okay. And the third line. Okay. And the fourth line. Alright. And the fifth line. Can you get the sixth line here? Good. Anything on the seventh line? No. That's okay. Okay, so your vision is 20/25, which is completely healthy and normal, so that's really great to see. So not to worry. Right, so we're now going to have a look at your fields. Your fields of vision. Okay, now I want you to look at my nose. I'm going to put my hands like this, and you need to point to whatever hand moves, but you must pay attention to my nose, okay? Okay, that was good. Let's check that one there. Okay. Just keep having a look. Good. Just needed to check that you could catch both fingers. Now we're going to look at your peripheral fields. So we're going to test each eye separately for central glaucoma. Now, okay, what we want to do is we're going to do the wiggling finger. Okay, so I'm going to cover one eye and I'm going to bring the finger in to your field of vision, and you just need to put your hand up every time you see my finger, this one, come into your field of vision. Okay, right. Great, we're going to test the other eye now. Excellent. Okay, now I just want you to focus on my finger as it moves all the way in and out and in and out. And now could you please just let me get this to work. So look up, look down, this side, and this side. Up again for me, down, this side, and this side. Great. No issues. Alright. Now, I'm just going to have a look at your reflexes as well. So I'm going to bring the light close and then back out, okay? So. I think this little pen is just not having a good time. Okay. That's better. Okay, so I'm just going to bring this in and back out. All the way back in and back out. So we're now going to look at cranial nerve number 3, 4, and 6. This is the oculomotor, the trochlear, and the abducens cranial nerves. Okay, so could you please focus on the tip of this pen here? There we are. You can focus on that, please. And I'm just gonna have a look into your eyes while you do this. Just focus on this. Okay. Okay, keep your head really still. Please follow my fingers. I'm going to make a H and let me know if you feel any pain when you move your eyes. So don't move your head, just move your eyes only. Okay. Do it again. Did you experience any pain? Okay. All right. So, I just want you to follow my finger. I'm just going to move quite quickly. Was there any pain? I also now want you to try and focus on this finger and then this finger. See if you can. Okay, so wiggles. Focus on this one. Now on this one. Okay, on this one. On this one. This one. This one. Alright. Excellent. So we're going to move on to cranial nerve number 5, which is the trigeminal nerve. So this nerve is responsible for sensation. So we're going to be testing the ophthalmic, the maxillary, and the mandibular sensory branches. So how we're going to do this is we're going to test with cotton wool, and then we're going to test with something a little bit sharper. We're just going to start with the cotton wool around your face, okay? Just let me know if you feel that. Good. 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 And now let me know if you feel this. It'll just be a gentle prick, okay? Can you please clench your teeth for me? Like, it's gonna feel around here. Good. Okay, can you please open your jaw and just please try and resist against me closing it? Alright. So we're going to do this again. We're just going to check your cornea. I'm just going to gently touch the very edge of this against the edge of your eye on this side. Okay. And on this side. Okay. And I'm going to hold this under here. I'm just going to hit up and see if your reflex of your jaw works. Great. Alright. Now we're looking into the facial nerve, cranial number 7. So I'm just going to have a feel around your face just to make sure it feels pretty good, which it does. Sounds good. Just looking at symmetry, so just making sure that everything looks symmetrical, your emotions. So I'm going to ask you to do some tasks for me so I can just have a look at your symmetry. Could you please raise your eyebrows? Great. Okay, could you please scrunch up your eyes? Great. Could you please puff out your cheeks like this? Great. And can you show me your teeth? Great. Alright. So we're then going to move on to cranial nerve number 8, which is your vestibulocochlear nerve. So I'm going to whisper a number in your ears and I want you to repeat that number. Alright. 9. 3. 7. 1. 68. 20. Great. And then I'm going to do the sound test with you just now. So I'm going to hit this and we're going to, well, first of all, I'm going to put it at the back of your ear. And I want you to let me know if you can hear the sound. And then I'm going to hit it and I'm going to move it around. And you just need to let me know when you can't hear the sound anymore, okay? Just putting this at the back of this ear. Can you hear this? Great. And at the back of this ear. Great. Just let me know when you can no longer hear it. Okay, so then we're going to look at cranial nerve number 9 and 10, which are your glossopharyngeal and your vagus nerves. So we're just looking for speech quality, looking for any hoarseness or quietness. So let me know, how are you feeling today? Good. And what did you do yesterday? Great. That sounds good. Can you open your mouth for me and say, ah? Great. Alright. Okay, I need to test your gag reflex. So, this is probably the least fun one. So we're going to use this tool here. Will feel quite it'll be quick, but it will potentially make you gag. So if you can open your mouth for me. Okay. Great. So we're going to look at cranial nerve number 11 now, which is your spinal accessory nerve. So if you could please shrug your shoulders, I'm going to put my hands here and just move against you, okay? And again. And one more time. Okay. And then I'm going to ask you to turn your head to your right, and I'm just going to push against it, okay? Okay. And to your left. And back to your right. And to your left. Great. And our final nerve today is cranial nerve number 12, which is the Hypo-Colossal nerve. So I actually just need to inspect your tongue. So just open your mouth quite nice and wide. Don't stick out. Just probably need my little light there. Alright. Okay. Alright, okay. Can you do this against each cheek? That's great. Can you stick your tongue out? Can you roll your tongue? That one was just a joke. Great. Okay. Well, now, are you comfortable? Good. Thank you very much for taking part today. Right, so just looking at this here, I have found no issues with your cranial nerves today. They're working very well, completely functioning in both their sensory and motor branches. So my personal opinion is that I don't believe your cranial nerves are causing you any issues with your insomnia. And actually your insomnia is being caused by a number of lifestyle factors. Now, it's probably important that you proceed and see your sleep therapist, who will be able to help guide you into better lifestyle choices and help you with different methods on how to get to sleep. But there's definitely not a medical cranial nerve issue here. But nonetheless, it was certainly a pleasure for you to come into my clinic today and to complete this cranial nerve examination. And hopefully you'll have a peace of mind now. Great. Well, thank you. See yourself out, and I will probably see you again at some point in the future.